My name is Singh. I'm an assistant professor of sports medicine here in the Department of Rehabilitation and Regenerative Medicine at Columbia University Vagelos College of Physicians and Surgeons. My role is primarily clinical, but I wear a lot of other hats. So spend most of my time and most of my days seeing patients, providing care for our patients here in the community. One of the other roles that I have here at Columbia University is teaching and mentoring our medical students, our residents, and our fellows, be it our sports medicine fellows or sports and spine fellows. In addition to that, personally, one of my passions and interests is just doing research, trying to uncover some more treatment options for chronic tendinopathies or use of shockwave therapy in the treatment of sports medicine injuries. All things that we really pride ourselves on here at Columbia University Irvine Medical Center is trying to innovate and improve patient care that we deliver on a daily basis. I always knew I was interested in training in physical medicine and rehabilitation, but it was actually during my residency training here at Columbia University where I fell in love with sports medicine. Working with our physicians here and just seeing how brilliant they were, how much they cared for their patients, and how invested they were in myself as a trainee at the time made me want to come back to Columbia University to work here as a physician. I treat all types of sports medicine injuries, be it from an acute injury or a chronic injury that's been bugging you for years. See not just high-level athletes, but also our community members here in New York City that just have knee pain when they're walking to work and need to feel a little bit better so that they can get to their job without discomfort. Conditions that I'm commonly seeing include tendon injuries, muscle injuries, bone or ligament injuries, and that can span from a variety of joints, be it the shoulder, elbow, hand, and wrist, or in the lower body, things like hip, knee, foot, and ankle. And our job is to try to work together to try to figure out what's causing the pain or the symptoms and how can we get you back to the goal or the activity level that you'd like to get back to. One of my passions is education, and that's not just education for our medical students or our residents or our fellows, but also education for our patients. You'll notice if you come see me in my clinic, I spend a lot of time focusing on anatomy pictures or drawings of injuries, talking to you about what structure I think is involved in causing your symptoms, and really just trying to empower you in being your own caregiver. Because I know that you'll only see me a few times in clinic, but then a lot of the hard work that you're doing is going to be on your own at home. I try to focus a lot on education in clinic because I know how much it can make a difference in your recovery process. So here in sports medicine, I think I have the best job in the world, and I'm excited to go to work every day because I get to work with highly motivated people in our community that want to get back to doing the things they love.